Welcome to this week's episode of the Politics Hour International team, where today we talk all things COVID. Yes, that's right. Welcome to our coronavirus special, which we explore, discuss, and debate the world of the current pandemic, its assumptions, contradictions, and its future. What we have in store for this week's episode is first the hot topical debate on vaccine nationalism, where Saffron delves into what exactly this means and its implications. Coming up straight after, we've also got the public's perspective. We ask people across the globe on their opinion of vaccine tourism. Following from that, now, have you wondered the role of organisations and their limitations behind the pandemic and vaccine rollout? Fuad tackles this by exploring and analysing the role of the World Health Organization, WHO. And lastly, we debunk all COVID myths on vaccinations. You should no longer have to worry. All of your questions will be answered today with the help of our expert, Dr. Andrea Collins. Well, sit back and relax and enjoy. This is a Politics Hour International. Goodness. Now, starting off with vaccine nationalism. Good afternoon, Saffron. What do you have on this today?
Hi, Dooney. So the first expert we have on today is Dr. Cheryl Walter, a professor of virology at the University of Hull. I spoke with her about the international response to COVID, as well as what vaccine politics could mean internationally.
Hi, thank you so much for joining us. So we'll just jump straight in, off to a pretty broad start. From the perspective of a virologist, what do you make of the global response to COVID? This could be in terms of an individual country or the combined global effort.
It's been a bit of a mixed bag, to be honest. In the beginning, some countries locked down and shut their borders. Some countries went for a bit of a half-mast like we did, and some countries didn't even bother with a lockdown. And that showed, and some countries have suffered more than others. But what we have learned from those initial preventative measures is that they were successful to some extent, but we're dealing with a virus here which is very easy to transmit. It's very easy to catch it. There are people who are asymptomatic that inadvertently spread it, and we have learned an awful amount of information in a year. And so even countries like Australia and New Zealand that have done everything that they possibly can to limit the spread still have cases cropping up. And countries like Sweden, who didn't lock down initially, they also have struggled with peaks and troughs like we have. So I think the initial response, there were lots of different approaches that went out. Some of them worked immediately. Some of them had an effect down the line. But on the whole, I think the response from countries has been actually very good. And so lessons were learned in the first 6 months, not only about the clinical treatment of patients with severe COVID, but also the collaboration between countries on investing in vaccines, collaboration in research and getting that research published as soon as possible, the basics about this virus, like how it's transmitted, where it's come from, looking at transmission, looking at particular groups that might be more at risk than others. So I think that collaboration and that coordination has really started to come into effect. And now, of course, we have a number of vaccines that have been approved for use. And now we're seeing a slight divergence in countries' different responses as to how to use those vaccines.
So from today, so obviously, again, this entire pandemic, the past 12 months have been a massive learning curve. So for right now, what do you think a model response going forward would be? And are there any countries that have sort of stepped into that?
I think the UK has actually stepped up to putting in plans an excellent response. So what we are doing is we are trying to protect our NHS, so trying to make available that capacity to look after patients that are sick with COVID. And then, of course, we are conducting clinical trials all the time to find better treatment methods for individuals with COVID. So that immediate clinical response is very effective. And then there's the vaccination, then there's a prevention point of view. And I think that response has been excellent. We agreed upon and we invested heavily on a vaccine, and there was a bit of luck involved there, and that vaccine paid off. And now we're rolling that out as quickly as we can. And we're going by the largest risk factor, which is age. And we're still sticking to the age group priorities. which is probably the sensible thing to do, and to keep with that regime, to keep with that schedule, and try not to diverge from that. So protecting the population as much as we can by administering a vaccine, and a vaccine which is very good. And then I suppose the epidemiology point of view about identifying not only where those infection clusters are, but also sequencing these viruses, looking at the genetic material of this virus. How has it changed, and how do we think it's going to change? So I suppose those are three main areas when you're looking at a pandemic that we're doing very well in. Starting right at the beginning, the basic research on the virus, the epidemiology, the contact tracing, then preventing those infections from even happening in the first place by a vaccination program, which is widespread, widely publicized, and is running very well. And then the downstream, how do we look after patients that do get serious COVID? How do we protect the healthcare services? How do we create that capacity? How do we get these people better quicker?
Obviously, around the world, we've seen a variety of different responses to the pandemic. What do you think has been stopping countries from implementing that model response that you spoke about?
One of the biggest limiting factors is finances and access to large amounts of money, not only to support people who might have lost their livelihoods, and to try and encourage isolation, to try to encourage the correct behaviours in lockdown, but also, of course, in investing in a healthcare system. And there is a huge discrepancy around the world as to things like the capacities of intensive cares around the world. And that makes it more difficult to manage those cases. So you've got to try and look after people and stop them from getting sick, and then support them if they do get sick. And of course, the vaccination schedule. I think what's propped up the vaccination schedule in countries that have different responses to us is that a lot of lower to middle income countries are in the COVAX agreement. And so they have pooled their resources and logistics together to try and secure a vaccine which is reasonably priced, which is easier to transport, and where everyone's in agreement that this vaccine is going to be prioritized to those countries in that agreement. So I think finances are probably the biggest factor involved in tackling these outbreaks. And it's not just about pouring money into vaccines, into treatment, but also supporting individuals in what has been a very, very difficult time economically, in terms of mental health, etc.
Well, considering all of the different nuances that come with, the implementation of these responses, how optimistic are you for the future prospects of the different vaccine programs that we're seeing around the world?
I think a lot of the vaccines that have been licensed for use are highly efficacious. And I think we're going to land up protecting with a lot of these vaccines that have come out, everything from the Russian vaccine to the Johnson & Johnson vaccine, which is the main vaccine used in the COVAX agreement. And then you have your very highly touted vaccines like Pfizer, Moderna, and AstraZeneca. And I think all of them are going to have a positive effect on reducing the number of infections and reducing the number of people who get seriously ill.
So when considering sort of how these vaccines are going to be rolled out, obviously you have the COVAX initiative and other sort of Western powers that are buying in bulk vaccines. We get the problem of vaccine nationalism coming up. What is the potential impact of vaccine nationalism on the resolution of the pandemic, do you think?
I think it will have an impact. I think the COVAX agreement is hopefully going to negate some of these effects of richer countries that have been fortunate with their vaccine investment, being able to hog a lot of the vaccines and a lot of their technology. So the COVAX agreement negates a bit of that. But I do think that it's going to have hopefully just a short-term effect, and that there are going to be delayed vaccination programs rolling out all over the world as most of the rest of the world is trying to get their hands on some vaccine. So hopefully that evens out in the midterm and the long term. And countries, especially in the COVAX agreement, are given priority for a very, very reasonably priced vaccine that can be shipped quite easily, can be administered very easily. And hopefully we see that playing field leveling out. But that discrepancy, it does mean that we're probably still going to continue to see epidemics, outbreaks around the world. And that is, of course, going to have a knock-on effect in terms of international tourism, international travel, the cost for people to go to another country and potentially have to isolate for a period of time.
Well, just off the back of that point, we've seen in other sort of epidemics and illnesses, such as like Ebola or AIDS, where it can sort of become a minorities illness. So do you think that there's a danger of rich countries sort of sorting themselves out and it becoming a minority illness or a global south illness that won't have the sort of global attention that it's got when it was affecting everyone?
I really hope that it doesn't. And we know that this particular virus is so easily transmitted. You could be next to someone in the shops. You could be on a bus. You could be on a plane. And right now it knows no social barriers. But hopefully we don't see that happening. But I think that if there are some countries which have far more financial resources and training available at their disposal, they straight away have an advantage in being able to track and trace individuals in order to sequence the virus isolates in their country, in order to roll out a vaccination program quickly and effectively and capture everyone in their population. So I really hope it doesn't happen, but there is that potential to see the almost like a different class system really emerging.
Okay, and just to round up, you seem pretty optimistic about the future of this pandemic, which will come as a sigh of relief to a lot of people. But what are some of the problems that we could be seeing in the coming months with the implementation of these initiatives nationally and around the world?
I think the biggest concern that we have on the horizon is the emergence of new variants and the establishment of things like the Brazilian and the South African variants in other countries. That right now is probably our biggest challenge. And what we need to, what we need to be mindful of is that, yes, those two variants are very concerning. We straight away started to get information that the vaccines might not be as effective against them. But there is still the opportunity to see yet more variants popping up. So that is our biggest concern. But looking further ahead, there are huge lessons to be learned here. We still don't know where this coronavirus came from. How do we stop something like this from happening again? And this coronavirus is one of 3 coronaviruses that have popped up in the human population in under 20 years. That's very concerning. The first 2 reached, you could probably call them epidemic proportions. And of course, the third one's hit pandemic proportions. And so we need far more research into understanding not only emerging infectious diseases in general, but coronaviruses. Why are they changing? Why do they have such a big reservoir that they can infect? And when I talk about a reservoir, I mean animals, sometimes it's insects that can be carriers of disease. How common are coronaviruses in animals? They are very, very common. How concerning is that? How are they able to jump between species, and how do we prevent that from happening? So those are some of the long-term goals that we really need to be a step ahead of, I suppose, in the game in preventing the next pandemic. And of course, we're talking about coronaviruses here, but we need to be very aware of influenza virus. And we have all gone through a whole flu season of virtually no influenza cases. And so that makes it more difficult to predict what the next flu season is going to look like. But also on a more practical level, it means that none of us have any immunity to some of the circulating strains that might have newly emerged. So we can't forget about flu, and flu is obviously, compared to coronavirus, relatively run-of-the-mill. We need far more basic coronavirus research, and we need to have a general approach in preventing the next pandemic, whatever that might be.
So a big thank you again to Dr. Walter from the University of Hull. So it seems, in spite of the tumultuous year we've had, we may finally be seeing the light at the end of the tunnel.
Yes, thank you, Saffron, and hopefully that light is closer than we think. Now, moving on, vaccine politics, that's a very significant word Saffron had mentioned in the last segment. How does the public view this vaccine politics? What are their opinions? Is there controversy among the public? And most importantly, what does this mean for the public's perception of vaccine tourism?
Well, that's a good question, Denny. The phenomenon of the wealthiest demographic of developing nations touring the world for medical resources is nothing new. In the context of the global pandemic, though, that has disproportionately impacted those in poorer regions, is jet setting around the world for sort of first dibs at a vaccine just a case of survival of the fittest, or is it adding insult to injury? Fuad spoke with members of the public to see how they feel about the issue of vaccine tourism.
Yes, thank you, Saf. Vaccination is an issue that affects all of us across the globe. So I took a virtual journey across the world to see how people feel about traveling to another country to get vaccinated.
In Holland, I would travel to Germany to get a vaccine because of dual nationality, and I think that's all right for people to do within the EU or within agreements that their countries have.
I live in Greece. Ethically, I don't know, or philosophically speaking, I don't think it's really fair for people to travel abroad to get a vaccination.
I am from Ireland, and no, I would not travel anywhere to get a vaccine because I'd be more concerned about picking up the virus during the journey.
I am an Italian. I would travel to take a vaccine.
Switzerland, we have a vaccination rate of about 14% currently. I would personally not travel to another country to get a vaccine. I think it depends on the wealth of the country and if a country can afford to vaccinate everyone, or otherwise to have more developed countries help out the less developed countries.
Hi, I'm in the Czech Republic. I would travel to another country to get vaccinated if I can't reasonably soon get it in my own country.
I wouldn't consider traveling to get the vaccine personally because I'm not at risk, but I would seriously consider it if it was an option for my parents in their mid-60s. It's clearly not right and not equitable, but I'm afraid it's been happening for decades, from developing countries traveling to Europe, US, Australia for healthcare. So it's just an expansion on that, unfortunately.
Hi, I'm from Slovakia. No, I wouldn't travel to another country to get a vaccine.
Hi, I'm from Malaysia. I would travel to another country if I can afford it, and if I have the money to, and get vaccinated. But I'm fairly young, so I'm in no rush, so I'll just wait.
Pakistan. I would definitely travel to another country to get a vaccine, and I think that's perfectly right because we recognize that some countries have more resources to get and give out vaccines than others.
Hi, I live in India. I wouldn't consider traveling to another country to get vaccinated.
I don't really feel that people should be traveling to get vaccines if they're not at risk and if they just have the money to do so, because I feel like it's unfair.
I'm from Philippines. I prefer to stay in my country and wait for the vaccine to come. And I believe other countries have their own issues as well with vaccine supplies.
I am from Uganda. I think it's right to travel to another country and get vaccinated because the vaccine which we take is the same and recommended by the scientists in the world.
I am from Syria, and due to financial issues, there is low vaccination rates in my country. So I decided to go to Qatar to get my vaccine from there. I think this is right since I hold the passport and visa to Qatar.
I am from Egypt. I think it's not correct to travel to countries if you have low vaccination rates, because this will be an opportunity for the rich, the people who can afford to travel to countries that have the vaccine to get it, while the poorer population will remain unvaccinated. These are the people more involved in manual work and work where they cannot do any kind of social distancing.
I'm in the United Arab Emirates. I have no opinion as to whether it's right or wrong. You could classify it as medical tourism, which people have been doing before coronavirus.
I'm Palestinian. If I afford it, why not?
Hello, I'm from Peru. I would not travel to another country to get a vaccine because...
So as you can tell, people have pretty mixed feelings about traveling to get vaccinated, depending on issues such as age, occupation, and ethical reasons. And there are those who believe this is just an extension of medical tourism. One thing that is clear, though, is that Europe's fledgling vaccination programs have certainly affected people's opinions on traveling. Of course, there's a whole host of reasons why people would be unwilling to or unable to travel, but unsurprisingly, it seems there is a strong belief that your own country should primarily be taking responsibility for your vaccinations, before resorting to traveling abroad. Saffron has been looking into this further. So, Saffron, what sort of packages are being offered? Is it that common?
Well, thanks, Fuad. In January, reports emerged of British elites jetting off to the United Arab Emirates for month-long vaccine holidays that included 2 doses of the COVID-19 vaccine for around £40,000. As well as this, an India-based travel company has been advertising vaccine tours in the United States and United Kingdom, the latter of which included a 22-day package from around £4,400, which is around 450,000 rupees. And this was first mentioned back in December. There have been some media reports saying that the extent of vaccine tourism is exaggerated, but we cannot deny that it's happening. It's a massive privilege to even consider it, and those who can often do.
Definitely. And on that point, I also asked our global panel what they thought about people coming to their country in order to get vaccinated.
I'm in the United Arab Emirates, and I think so long as a country has enough resources, then they could definitely vaccinate foreigners. I think this virus came from one country and now it's all over the place. So it makes sense that the vaccine should also be available to people from different countries.
So Bangladesh, I have a high vaccination rate in my country. I would feel like you shouldn't come to my country to get vaccinated because it's completely free, so it would take a toll on our national resources.
If there can be a guarantee that there's more than enough to go around, then everyone has the right to health care. It's a fundamental human right.
I don't think that people should travel to this country to get vaccinated, as it distorts the rollout in the host country.
I'm a student from Hong Kong, and I don't really care about people traveling to Hong Kong to get vaccinated as long as there are enough vaccines for the locals.
Definitely they are all welcome till such time the COVID restrictions and the certification which are required in international travels are adhered to, then I have no problem.
Hi, I'm from Slovakia. I would be happy if other people would travel to my country to get the vaccination.
I would feel perfectly okay about people traveling to my country to get vaccinated then, because at the end of the day, it's all about sharing resources.
I think it's okay for people to travel to my country to get vaccine if they cannot get it in their country.
That's not right at all to people to come to the higher vaccination to get the vaccine, because each country has numbers of population they have to get it, and that's very selfish on themselves to get the vaccine from another country.
I live in America, and if people wanted to come to get vaccinated, I wouldn't mind as long as they were high priority, either meaning above 65, immunosuppressed, or healthcare workers, and they didn't have access to the vaccine in their own country, then yeah, I wouldn't mind if they came to get vaccinated.
I live in Australia. I would be fine with people traveling to Australia to get vaccinated once our population had been vaccinated.
Israel. We have quite high vaccination rate, and if someone wants to travel and get vaccinated in Israel, he is more than welcome.
Again, a fairly mixed response, but what is interesting is the idea that those from countries with higher vaccination rates seem happy for people to come to their country to get vaccinated, as long as it does not affect the rollout for their own population. However, there is opposition from people in countries where vaccination rates are lower, and some of the reasoning goes back to the wealth inequalities of this issue of vaccine tourism, and medical tourism opens up. In the context of global pandemic, these inequalities are increasingly visibly exposed. So Saffron, what are the potential effects for countries with high vaccination rates if vaccine tourism becomes commonplace?
Well, we know that there's already a scarcity problem with vaccines. So especially in countries where access to medical resources are based on who is most able to pay, we could see a state of affairs where a country's stock of vaccines is depleted by these wealthy medical tourists. As for the lower income portion of the population, it could mean that they don't have access at all.
Now, that was an interesting segment on vaccine tourism, hearing the many different views there. But moving on, we explore the role and vindication of global governmental bodies in response to the coronavirus pandemic and vaccine rollout. Fuad delves into the role and function of the World Health Organization to find out how their contributions has played out internationally. Fuad, what do you have on this today?
Well, thank you, Dunny. So the World Health Organization has, of course, played a key role throughout the pandemic. However, it hasn't been immune from criticism, as we have seen world leaders criticize its approach in issuing advice and dealing with certain states, namely China. But as with all intergovernmental organizations, its functions and effectiveness is not always in its own hands. To explore its various strengths and limitations, I spoke to a professor of epidemiology, Dr. Tom Loney. Dr. Loney has also worked as a director in the WHO and continues to be involved in the organization as an advisor. In an ordinary pre-pandemic world, what is the role of the WHO?
But its main objective and main goal is, is for everyone, regardless of which country you live in, to attain and maintain the highest level of health and well-being. Obviously, it's part of the United Nations. So as an intergovernmental organization, it has a very wide remit if we're thinking about global public health. So the WHO focuses on global public health, which includes a very wide range of health issues in today's modern world, including emerging and re-emerging infectious diseases, such as the current COVID-19 pandemic, but also non-communicable diseases, and also other health issues such as health systems, health insurance, occupational health. So quite a large remit.
Yeah, definitely. And I guess sort of following on from that, what do you think limits the WHO in terms of carrying out their functions?
So that it's complex, I think, in the organizational setup. I mean, it has over 7,000 employees across the headquarters and the regional offices. And obviously your funding structure is reliant on your member states, who have maybe sometimes contrasting priorities regarding global public health and also population health within their own countries.
And in the context of a global pandemic, what sort of procedures are in place for the WHO to move what may be called an epidemic onto the pandemic level?
So the P word. So there may be some reluctance to declare a global pandemic, and you can read various opinion articles criticizing the WHO. So the WHO relies on receiving data. So it relies on receiving, to make data-driven decisions. It requires the Ministry of Health from individual countries to feed data back to the WHO. Different organizations, I mean, there's no global consensus on the criteria to define a pandemic. I mean, the CDC has its own criteria. Previously, the criteria has been based on influenza pandemics. And obviously, coronavirus is different to influenza. So from an epidemiological perspective, it was a pandemic. But obviously, once it's labeled a pandemic by the WHO, this then sets the wheels in motion for the WHO, but also for many countries to initiate their pandemic management plans. It's easy with hindsight to criticize. I think when you're put in these positions to make the decisions, you have to be very clear and confident. And the WHO, I think, back in 2009, they declared an influenza pandemic, which I don't think sort of materialized to be a pandemic anywhere near COVID-19. And they were criticized heavily. So perhaps they were, and the difference is that we had lots of influenza pandemics. Whereas this was a completely novel coronavirus. We really didn't know much about it at all. And I think that was related. That was seen in how the evidence has changed for communicating public health measures.
And sort of, following on from that, and in terms of the criticism that you mentioned, it's been fairly clear that the WHO Director General Tedros Ghebreyesus has opted for a more cooperative strategy when dealing with individual countries, and we've especially seen that with China. Just wanted to get your thoughts on that approach, and I mean, do you think the WHO should be more vocal in criticizing individual countries who perhaps have been steering away from their advice and much of international health advice?
I think, again, it's very challenging. I don't think the WHO's role is to, to criticize countries. I think its role is to, facilitate cooperation and, encourage a harmonized approach to improving health at a population level. With regard to the COVID-19 pandemic, SARS-CoV-2 was a novel virus, and essentially every country is conducting a natural experiment, with how they try to control the spread of the disease, how quickly they manage to upscale their testing, their containment, their mitigation strategies, and most of those decisions are based on specific factors within the country. So one thing we know that age is a clear risk factor for severity of disease and death with COVID-19. So, high-income developed countries have a different age structure. They're predominantly an older age structure. So, the burden of disease or severe disease and death is most likely to be higher. And then you have, the perhaps lower and middle income countries where you have a younger age structure and maybe different health systems. So I think the WHO provides technical advice, and then, it's up to individual member states to decide on, whether to fully or partially implement the measures based on the resources available, the funding, the geographic spread of the population size. But I think definitely speed is of the essence in pandemic management. And I think if you look at the countries that I would say, I say the UAE, for example, acted very quickly. Singapore, and some of the other Southeast Asian countries that also had experience with the original SARS outbreak back in the early 2000s.
And I guess just sort of moving on a bit to COVAX and the kind of the recent scheme that we've seen kind of start to come into action, and we've already seen vaccines being delivered to a few different places across the world. Do you think the WHO will be able to achieve what they have set out with this scheme? As it is quite a far-reaching and ambitious goal, and something that's never really been done on this scale before.
I truly hope so. I think it's an ambitious mission, but I think it's very much needed. I think now, if we think about global public health, the world is very much a village. All countries are connected, and we can see that with how quickly COVID-19 has spread across both the developing and developed countries. I think some of the issues with COVAX is obviously at the stage of the pandemic at the moment. Everyone wants, all countries want to vaccinate the large proportion of the population as they can as quickly as possible, because they want to try and move to a herd immunity, or at least try and reduce the strain on their health system. So by vaccinating people, they may still develop COVID-19 disease, but it might not be as severe. It could be mild, or they could be asymptomatic. So, most countries are looking for a return to normality. But then I think at the same time, unless everyone moves at a similar pace, because if you still have large amounts of the virus circulating in certain countries, then eventually, because of the connectedness of the world nowadays, and the virus will mutate, and you could essentially have another outbreak that leads to a similar situation. The only thing I was thinking about earlier is sort of the old Chinese proverb where, if you give a man a fish, he can feed himself for a day. If you teach a man to fish, then he can feed himself for the rest of his life. And I guess, delivering vaccines to countries is important. They then need the supply chain, and they need the personnel and the capacity within the country to be able to reach all of their population. But I think if you focus on helping some of these countries develop and manufacture vaccines, their own vaccines, and obviously for the timescale of COVID-19, that would be challenging. But I think longer term, they have the manpower, they probably have the industrial infrastructure needed. So perhaps some of the funding could be focusing on sort of building capacity within these countries going forwards to develop and manufacture own vaccines, and then in the future they would have, a more readily available supply or maybe access to some vaccines that they need.
Just something specific about in terms of what will limit COVAX in terms of its functionality and effectiveness. I've been reading about the Chinese vaccine, for example, and how it hasn't got WHO approval yet, and just sort of wondering what your take is on their kind of approval process, and whether or not the scheme and general World Health would be better off if we could get more of these vaccines kind of approved and sent out, whilst a lot of the AstraZenecas and the Pfizers are kind of struggling to keep up with the demand. So
yeah, I mean, it's a very interesting question, and I think since over the past year there have maybe been around approximately 260 different vaccine candidates for COVID-19. On the top of my head, I think there are somewhere between 6 and 10 that are at market at the moment. Some have emergency use authorization only. There's obviously the Chinese and also the Russian vaccine. And if you look at the clinical trial data, which has been published for some of the vaccines, then they offer different levels of protection in different groups, but essentially they all offer some degree of protection with minimal, if not no, side effects. The exact approval process, I guess, may seem bureaucratic, or it may seem slow, but then I guess on the other hand, you have to ensure that if you're going to vaccinate a large portion of the population, you need to be very confident that the first thing that is safe, because although the clinical trials are done in quite large, reasonably representative samples of the population, you obviously have, in the general population, people with very different underlying health conditions or diseases, or genes. There could be some host factors that influence the vaccine efficacy or safety.
And just sort of to kind of round off, I was reading earlier that at a press briefing this month, WHO senior advisor Dr. Bruce Aylward said simply, and this is something that you touched on earlier, actually, we can't tell individual countries what to do. But I guess sort of one of the big things that's come into light with the WHO over this pandemic is, the world is, like you said, becoming an increasingly smaller place, and globalization is kind of contributing towards that. In light of that, how do you think that the WHO can or should change?
Excellent question. I mean, it's does it need to change? I think if we look, I think we can always improve. I think the organization is it's a very large organization. You've got 7,000 multinational employees across 6, the headquarters, 6 regional offices. It's whether they want to continue having this broad, all-encompassing sort of global public health scope, or whether they're going to look to maybe become a bit more focused approach, or have a more focused mission in certain areas. There's a significant amount of research that's being conducted by the WHO, and I guess the question would be whether they're ever thinking about narrowing their focus, and then also whether they could learn anything from similar large multinational organizations. I mean, there are some very big private companies, sort of big business, who operate both internationally and locally in different conditions, and whether they could learn anything from the organizational structure. I mean, they have different missions. The WHO's mission is to improve population health in many different settings and countries, and multinational companies are focusing more on designing, developing, and delivering a product to make a profit most of the time. But I wonder if there is anything that they could learn from the sort of organizational structure of some of the large multinational companies.
Very interesting, and hopefully we'll see this develop over the next few years. Thank you very much for joining us. That was Professor in Epidemiology and WHO Advisor Dr. Tom Loney discussing the WHO. I just want to pick up on a point Dr. Loney made regarding the Chinese vaccines and how they are awaiting approval from the WHO. Dr. Loney mentions that the additional vaccines from countries such as China would, of course, help the COVAX scheme in vaccinating people across the world and giving them some level of immunity. Of course, a lot of this comes down to individuals willing to take the vaccine. So, what are people's attitudes towards a non Western vaccine? How does global politics affect people's perceptions of Chinese or Russian vaccines? To answer these questions, I spoke to a range of people across the world.
Would I take a Chinese vaccine or Russian vaccine? No, I wouldn't, because first, they're not very effective. I believe the effectiveness is about 50%. Secondly, is there are a few deaths related to Chinese vaccines, so I wouldn't trust it.
I don't know whether I'll take any of them. I'll probably stick to the UK one.
I think Chinese vaccination can be good because these are the first people to bring this disease in the world, and we have been following their SOPs from day one. So let's try their vaccines as we protect our lives.
For me, neither Russia nor China. Reason being, they're communist country. What they say, what they do not say, there is no proof what they're saying is right or wrong.
Yes, I have no problem in taking a Chinese or Russian vaccine.
I would not take the Chinese or Russian vaccine just because I do not personally believe in the statistics that they are releasing.
I'm from Pakistan and we use Chinese products and I don't find them very durable. And as far as Russian vaccine is concerned, we have knowledge of the Russian MiG-29 aeroplanes. They are also damaged and faulty machinery. I won't trust either of the two vaccines.
In terms of getting a non-Western vaccine, again, I'm in Pakistan, and so I probably will get a non-Western vaccine, and I'm very okay with it. I don't feel worried or anything at all.
I'm in the United Arab Emirates and I'm comfortable taking the Russian or the Chinese vaccine. The reason why I'm comfortable is because the way it was developed is traditional, it's orthodox, and it's the same method we've always known for other vaccines as well. I'm not too comfortable with the Pfizer one, for example, because new technology is being used and it's something that we don't completely understand yet.
I prefer the Chinese vaccine since the virus is first known in Wuhan, a Chinese city. So I think they are the one properly capable to produce this vaccine to all people as they spread it all over other countries as well.
Personally, I took the Chinese vaccination and I would have taken the Russian as well if we had enough data for it.
Without doing much research, I've got good feedback from friends around the world about the Sinopharm Chinese vaccine.
Hello, I'm from Peru. No, I would not take the Russian and Chinese vaccination.
I would prefer to get a vaccine that is not from Russia or China, but if the World Health Organization would approve these vaccines, and also in my country, if it would be approved, I would take it.
So as you heard from people across the world, perceptions of the Chinese and Russian vaccines vary greatly for a variety of reasons. It seems most people very much trust their own country's vaccine approval process and would base their decision according to that or their own individual research. To focus on China, however, it is noticeable that a lot of people base their answers on their country's political relationship and their own perceptions of China, especially since it is believed that the virus originated there. Of course, a lot of these worries would be alleviated through China publicizing data on their vaccines, but we haven't seen much transparency so far on the two major Chinese vaccines, Sinovac and Sinopharm, whilst China has also continued to authorize a fifth vaccine for use. China doesn't seem to feel the need to reveal more data to win more international confidence, so there will always be hesitancy because of the relative lack of transparency and independent verification, particularly in a highly sensitive area such as medicine. As long as Western vaccines remain expensive and inaccessible, most lower income countries will not have a choice but to purchase Chinese vaccines. But there are a lot of questions people want answered before taking the Chinese vaccine, and people understandably want to get the best protection they can. It seems the only way some perceptions may change is if there are no other alternatives whilst we're still in this acute stage of the pandemic. Back to you, Dunny.
Extremely interesting, Fuad. I just want to touch upon the word trust, as this takes us onto the deliberation and assumptions of the many different vaccines that are out there at the moment. So, welcome to this week's Fact Check, where today we explore COVID vaccines. Time is approaching in the UK and already around the world, where young adults, if they haven't already, have taken one of the coronavirus vaccines. But there has been a surge of disagreement among millennials across the world for months who are rejecting in every sense to not take COVID vaccinations. Now, we have expert Dr. Andrea Collins, who is co-principal investigator on the trial in Liverpool on the world's first COVID-19 vaccine alternating dose study at Liverpool School of Tropical Medicine. She is here to debunk these myths for all you listeners and those who are genuinely worried and undecided about COVID vaccinations. Now, we have a bunch of assumptions and myths that the public have put forward. This is what many of them have to say, and all of them have been debunked. Enjoy. Firstly, starting with these Chinese vaccines, what do we know about Chinese vaccines, specifically Chinese Sinovac vaccine? Are they reliable? Would you take it?
Now, the way that they manufacture those vaccines is in a much more traditional way. So they basically do it with it's a dead vaccine. So it's a dead bug, dead virus, which is how we manufacture a lot of the vaccines that people will have had already in their lives. The data from that didn't look as good in terms of, as many of you will be aware, the primary endpoint of a lot of these studies is symptomatic disease, it's called. Now, that I don't believe to be the best thing that we should be punting around as the kind of headlines, but it's nice for the media to say 95%, 70%, etc. And the Sinovac one came out looking less good. The data also wasn't kind of quite as forthcoming and done in such a clear way, I don't think. So the way that it was released made people feel a little bit dubious about it. But there are many reasons behind that. They're a bit complicated, but the general thing is that it was done over a couple of different countries, but the data is good, that it is safe, and it also does protect from dying and protects from severe disease. And ultimately, my feeling with these vaccines is that working backwards, what you want to start with a vaccine is you want it to be ultimately safe, but you want it to stop people dying, and you want it to stop people being hospitalized and going into intensive care. They're the main things, because otherwise we can't get back to any kind of normal life. So that vaccine, the Sinovac coronavac vaccine, does stop people dying. And so, yes, I would have it. And I think people worry sometimes about these vaccines that are from China, and I honestly believe that they are safe and effective. But I think that it would be nicer if sometimes if the data was presented to us in a more sort of standard mainstream way that we're all more comfortable with. So I can understand why people are reticent slightly with those vaccines. But if I was living in one of these potentially lower middle income countries, or a country that had a very high rate of coronavirus, or a very poor infrastructure of health care, I would be having one of these vaccines, because you're at such high risk in those countries anyway. It's got to be better to have a vaccine.
Now, many have expressed their opinion as to why they will not be taking COVID vaccinations, and this is what some of them had to say.
The vaccine is rushed. Not enough time was invested to check for any long-term side effects.
First, the vaccines aren't safe because they were developed quickly. Is this true?
Right. So the quickness is amazing, and is not to think that we cut corners. That was not what happened. So research is, I'm a researcher normally. Research is interesting, but it is sometimes not exciting and fast paced, because it takes a long time to get things through regulatory approval. So a bit like, if you apply for a passport, you can wait 6 weeks, or you can go on the day and you can get it done because somebody can get it done. Yeah. That's sort of how the systems work. So if I submit something now to the MHRA, the Medicines Health Regulatory Authority, I might get a response within 30, 60, 90 days. Yeah. That's on another kind of, if it was, say, a pneumonia vaccine, not to do with coronavirus, which is my normal work. If I submitted one today about coronavirus, they would probably assess it tomorrow or the next day. And so you've saved 3 months, just like that. So you haven't changed the study design or done anything quicker. It's just that the sort of normal, slower kind of processes of bureaucracy are quicker. So that is one thing that's made it super quick. The other thing that made it quick, sadly, was the fact that the pandemic got worse again. Because ultimately we needed people to get infections to prove whether it worked or not. So it's probably quite clear to most people, but just to explain, so half of the people have not got a vaccine on board, an active COVID vaccine, and half have got a possible active vaccine. So then you have to wait for everyone to get disease, and you need a certain amount of people to get disease. And what you want ideally is for people to get disease, which sounds bad, doesn't it? But you do, to prove a vaccine works. So you have, say, 50 people in this group that get disease and nobody in this group that gets disease, and that shows 100% protection. So ultimately, if nobody got disease again because the pandemic had just gone, we never would have got to show that the vaccine worked. But unfortunately, in the wave that happened in September, October, and November, and in Liverpool, we were hugely hit in September and October when other areas weren't. And then therefore we got it licensed really quickly because we could prove that it worked. So no corners were cut. It's just that things ran in parallel rather than in series at times to make certain that we pushed it through. So I hope that answers the question.
I never get sick at all, so why would I need a vaccine? Also, does the vaccine for this virus have a 0.002% fatality rate? What do you think?
Okay, so the first thing is it does not have that fatality rate. That is quite straightforward. In the UK, 20 million people, more than that, have been vaccinated, but about half with Pfizer and half with the Oxford AZ vaccine. There have been no known fatalities that I'm aware of. There were a number of people that got anaphylaxis, and the rates of anaphylaxis, which would normally be quoted as about 1 in a million, are actually more like 10 in a million. Still pretty low, but it was predominantly people that have previously had anaphylaxis, and they were given vaccines normally, well, they're always in a healthcare setting, but often in hospitals. The anaphylactic symptoms happened within sort of 15 minutes when they were still being monitored. Some of them went to intensive care, but everyone lived. So that was the anaphylaxis. In terms of the other kind of fatalities that you might expect, there were a lot of things that went through the media early on in the Oxford study about transverse myelitis, which is like a condition that can affect your spine and how your arms and legs might work. And also currently, obviously, there's a lot of stuff about thrombosis risk, so blood clot risk as well. But to my knowledge, there have been no known fatalities directly associated with the vaccine. I also don't know, because none of us know, what the risk of having had coronavirus is many years down the line. So whilst we don't know that vaccines are safe in 10 years, I can't tell you that there won't be any issues related to the vaccine. I also don't know that there will be no issues related to having had COVID, and so anything that can protect you from getting COVID has got to be a good thing. So, and taking back to your first question, you never get sick. Now, I don't really ever get sick, and I had coronavirus in November. I wasn't super ill. I had like a high temperature. I totally lost my sense of taste and smell for 2 weeks, which was pretty annoying for eating. I had a reasonably bad cough. But I was okay. So yeah, I do get that. I understand that people say, but I'm normally well. But the problem is that there are plenty of people my age that died of coronavirus that were also fit and well. And we do not understand why some people get ill. So you just don't know when your card's marked. It could just be you that's the one that ends up in ITU. And also, if we all have that attitude, then the ITUs are full. And so when I want to go and get my bed in ITU because I refuse to have my vaccine because of some minuscule risk, there is no bed in ITU for me. Well, how do you feel about that? That's slightly different, isn't it? What if the ITU bed was actually for your mum that was about to have, potentially curative cancer surgery that has now been cancelled because you're in the ITU bed because you're in your 20s or 30s or whatever, and you've got coronavirus and you're taking that person's slot, and now they're going to die of breast cancer or whatever else because that bed was taken. And so we all got a social responsibility to look after each other and act not as just as an individual, but as a group of humans that are acting as a community in a pandemic, and we've got to do our best.
I've already had COVID-19, so I don't need to get vaccinated.
People believe because they've already had it and they don't need to get vaccinated. Why do you think this is, and how can we stop this belief?
Okay, so there's actually some really good data out there to say you are actually pretty protected. So it's not unreasonable to say, I think I'm probably okay for not having a vaccine for a while. But so the data, if anyone wants to look at it, is from the SIREN study, SIREN, which is a healthcare worker study. And the current statistics show that at about 5 months post natural, I want to call it natural infection, you are protected by 85% probably from having had COVID. So you probably are protected quite well. But there are people that get COVID over and over again. And in fact, I was just with a colleague the other day who got COVID in March, got it again in December. And each time, the first time we ended up on CPAP, he's in his 40s and is a young, healthy doctor. The second time he was okay, but he got really high temperatures and he'd actually just had one of his vaccines, but not long enough before, sadly. He has had it before and he's got it again, and he did get it less bad, I think, but we don't know that you get it less bad. And we don't know about these new variants and what they might do. We know that obviously the Kent variant does tend to spread more and does have a higher risk of mortality. So if you were coming to the end of your kind of immunity, as it were, having had COVID, you could well get one of those, and you could just be unlucky, and you can end up with a COVID complication as well. Remember, it's not just COVID necessarily that kills you, like the virus. You could end up with a blood clot related to it, which might kill you or might seriously, cause problems going forward. There are a lot of other issues. So so I would say you don't have to get a vaccine immediately. You can wait a month or two after your COVID. That's perfectly reasonable, but get a vaccine still. The other thing is it reduces your chances of transmitting it to somebody else. So you've just had COVID, you don't want to give it to anybody else, so have a vaccine which may well stop you being able to spread it in the future as an asymptomatic carrier to other people.
Most serious long-term side effects of vaccines would still start to present themselves after an 8-week period, which was observed in these trials. This is why I'm unsure of getting the vaccine.
Now, as you mentioned before, we don't actually know if these vaccines can lead to long-term effects. But I think a lot of people, just vaccines in general, not just the COVID vaccinations, have this issue that vaccinations and vaccines will lead to a long-term effect. How can we stop this belief and this worry of what people think?
I think it's really hard. And I think that we live in an age of just doubt. We love doubt stuff. People love a conspiracy theory. I think it's probably partly because we haven't got enough to do at the moment, because we're trapped in and we're not seeing our friends and talking about other things. So, I hear people all the time talking about what brand of vaccine they got. And, and did you know I had a side effect after mine? Did you? My arm hurt. Oh my goodness, shock horror. It didn't, did it? So like short-term effects, I mean, they're called side effects, but I would prefer we don't call them side effects. It's pretty obvious that if you've had a vaccine in your arm for something that can kill you, like coronavirus, it's probably going to hurt a bit. You're probably going to have a temperature. You probably might be in bed for a day or two. Just accept it, that is like an effect of the vaccine, not even a side effect. A side effect to me is, concern about, a longer-term risk of, I don't know, thrombosis 5 years down the road, or increasing your risk of some weird condition. That is a longer-term effect. So I think you're right. I think until we can kind of address people's issues with vaccines as a whole, people will always be doubting. And it's a difficult thing to know that the science is right and the scientists are true and fair, and to believe in that. People are not trying to pump you through with microchips. Pfizer are not trying to control our bodies. Bill Gates is not. Honestly, if science can manage to make a vaccine, if anyone would like to see the way you draw up the Pfizer vaccine, it is crazy. There's no way you could guarantee you would have little microchips in each of the doses that go into people when you've done all of that, when it's been at -80. There's just no way, but you can't shape the misinformation, and it makes it really difficult. So you just have to believe in the truth, and that misinformation is there to disrupt society, and that's what people are trying to do.
Will the vaccine work against all the different strains of the coronavirus?
Yes, they do, but they may not be as effective. They hopefully are as effective in terms of the important things that I mentioned before, which is severe disease and hospitalization and death, but they may not be as protective either against transmission or against mild to moderate to possibly even more severe disease. And so the vaccines will be altered slightly. And they will go into very small clinical trials just to check, to do with immunity, to check that they seem to develop as much as of a good immune response against kind of standard strains. But they will constantly, because coronavirus isn't going to go away, the vaccines will constantly be developed like that, like the flu vaccine changes every year. So the Oxford vaccine, for example, at the moment is currently being manufactured in a small batch to look at how we can make it better against the South African variant, against the Kent variant, etc. But they do still work, and that is not a reason to not have one.
I just want to bring up again this talk of misinformation, and I think you put out such a good point, saying you can get misinformation from information, true information that is, and also this idea behind fertility in the vaccine. Why is it such a big issue?
Misinformation, the strongest way to get misinformation out, if I was going to be, the kind of devious, kind of crazy people behind this, is to try and find something that is true and slightly twist it, because that makes it much more believable. So infertility. So the vaccines do not cause infertility. That's the first thing to say. And as a younger woman myself, I would have been concerned. I do understand that, but it does not. In the Oxford study, again, as I said, 1,000 people in Liverpool and 12,000 people across the UK. I know of 40 pregnancies in that study, and that data is going to come out hopefully in the next kind of few months, but 40 people in a study that were told to not get pregnant. So if you were in the study, I would have said, are you using contraception? You know, do you have regular intercourse? Are you using contraception? What have you got in place? And said to you, you are not to conceive during this trial. So it's a 1-year trial that started in May. So you are not to have a child, okay? And you'd be like, well, actually, I want one, so I can't be in the study. Fine. So that was what happened with every woman. But despite that, 40 people accidentally got pregnant. I mean, seriously, that there's no way that can cause infertility. 40 accidents is a lot of accidents for you know, accidental pregnancies, or you know, or people that kind of just thought, you know, I'll do it anyway. Yeah, it does not cause infertility, but what does cause infertility is coronavirus itself causes temporary infertility. So in the 70s, there was a reduction in fertility in men, and cyclists also have this problem because the male's testicles need to be at a reasonable distance from your body. If they are squished too close in, or if your testicles get too hot, your sperm are very sensitive and they do not like it, and they do not then work very well to conceive children. So if you get a temperature from COVID, and we know that the temperature from COVID itself is often prolonged and really quite high, you know, 38, 39 for many, many days, you will get male temporary infertility related to that. So that's where this misinformation has come from. It's come from a seed of truth. So if you don't want to stop, if you want to try to prevent yourself getting infertility temporarily, then don't get COVID. So I suggest you go and get a vaccine, which will prevent you getting COVID and will prevent you having temporary male infertility. But the carrot that's being, well, the horrid thing that's being held above women's heads, I think in particular, is that it's just that horrible thing. It's the perfect misinformation, isn't it? To say that you will have done the right thing for society, but in 20 years' time or 10 years' time, you won't be able to have children. And that is just simply not true. No vaccines have ever been shown to do that before. And there is nothing in this vaccine that would cause infertility.
And I think I also want to talk about how cultural and religious beliefs also have affected people from getting vaccinations.
One of the kind of religious things that kind of came out again is that the Oxford vaccine, for example, has got chopped up baby male fetus in it. Now, it does not. That's the first thing to say. It does not, absolutely. However, we grow cells and we do weird things in science that sound weird to people. And in science, sometimes we use cells and cell lines like that, they're called cell lines, to grow things in. So part of the Oxford vaccine is grown within those cells. It was actually a baby girl fetus. And so you can see how the misinformation again is from information, but it's actually incorrect. There is no fetus within, you know, the vaccine. We've been doing quite a lot of work in sort of with minority ethnic kind of promotion, really, because it really surprises me how the people that can be most at risk are the people that are often most vaccine hesitant. But I think a lot of it comes from a not believing the sort of the politics and the place that you live in, and a lack of trust, you know. So do they trust doctors as a whole? Do they trust science? Do they trust politics? But if you're untrusting, or if you've had, you know, bad run-ins with the police, you know, with trying to get visas, with any of those things, they make you distrust, and that becomes kind of really integrated into whether you'll have a vaccine or not. And I think that's what we've kind of got to try and work towards, is people believing and trusting, and then we can work forward. And we really need the help of cultural leaders and religious leaders to kind of really, you know, be the ones saying, here's my vaccine going in. You know, I've had a vaccine, you should too. And that they should be really trying to stop vaccine misinformation and really trying to promote vaccines.
Now, that was Dr. Andrea Collins. Thank you very much, enlightening the vaccination worries for you all. Now, I hope you have all enjoyed this week's coronavirus special from COVID nationalism, tourism, and debunking vaccinations. We hope you've got all the information you need to be COVID safe and sure. I'm your host, Dooney, joined by Saffron and Fuad. This is the Politics Hour International. See you next week.